My name is Xiomara Owens. I usually go by Zio, and I am the director of the Behavioral Health Aide Program at the Alaska Native Tribal Health Consortium. I've been with the BHA program for 15 years. And today I am going to answer a number of questions that have been submitted where people are wanting to know a little bit more about mental health and behavioral health. So the first question is, what is mental health? And I'll start by saying that mental health is more than just the absence of mental illness. Mental health is referring to people's ability to be well, to feel well, to have healthy thoughts, to have healthy relationships, and really to be well enough to reach your full potential. What is the difference between mental health and behavioral health? I'm going to start by saying that behavioral health is actually the broader term that encompasses mental health. It also includes reference to substance use, misuse, or addictions, and then any other facets that are tied to behaviors that influence your overall well-being. So this can include mental health conditions such as depression and anxiety, substance use, misuse, and dependence. When I think about behavioral health, I think about the ABCs of behavioral health. That includes your affect, your behaviors, and your cognitions. In other words, the way you feel, the way you think, and the way you interact or the way that you act in life. What mental or behavioral health challenges do people face in Alaska? Us being so far north and our access to the sun around throughout the year, sometimes it gets darker, and that will naturally influence or impact the hormones and chemicals that are running through your body. And that can make people experience depression more often, perhaps when it's darker. So when I think about the weather in Alaska, a lot of times if we get dumped on with snow or it's really windy or the weather is really bad, it makes you not want to go outside very much. But that can also, that can impact your wellness when you're just holed up inside your house much of the time too, or you're not getting the interactions that you would typically get or getting to be as physically active as you typically would be. So there are lots of different factors that really influence how often people might experience these. What are some healthy ways to relieve stress or improve mental health? One of my biggest recommendations is often do something that helps you to get out of your head. A lot of times we're having our internal dialogue and we're struggling with it and we get stuck in that and we're forgetting and losing the ability to be present with what's around us. So some quick and easy ways to address that is really to look at all your different senses, right? Look around you, try and identify 5 different things that you see. What are 5 different things that you hear, that you taste, that you can feel, right? Really hone in on your environment and take some time to get out of your head. I would also say and encourage people to not always believe everything that you think. Our brain is a very, very powerful organ, and oftentimes we think that we have to believe every thought that comes to our mind, and that's just not the case. So it's okay to question your thoughts. It's okay to just watch the thoughts fly by, and it's okay to just take some time to not think. I would also encourage people to participate in traditional activities. All right, so getting out on the land, getting in touch with the land, doing berry picking, going fishing, tying ties, hunting, the process of processing the meat. All of these, I would generally call these mindful activities. You're being present with whatever activity you are doing. And it also involves your whole mind, your whole body, and oftentimes community. So surround yourself with community. Lastly, I would also say if you're struggling or you're just not sure or you're having a lot of internal dialogue that you're struggling with, talk to someone. And it doesn't have to be a behavioral health professional. Sometimes you can get clarity just by talking to your sibling, by talking to an elder, talking to a priest, talk to your colleague. Find someone that you feel safe with and find the space where you can express yourself freely with no judgment. When should someone reach out for behavioral health assistance? And honestly, there's no right or wrong answer. If someone is not feeling well, if they are struggling with their thoughts or their relationships, or they're just not able to understand, why is my brain not working the way that I want it to? But when it gets to be unmanageable, or when you feel like you don't have the right skills, tools, or knowledge to help yourself to be better, that can be a good reason to go and talk to someone. There are a lot of resources available for people who experience mental health and behavioral health conditions. Again, it can be as easy as talking to someone that you trust. It can also be a matter of becoming knowledgeable, so doing some research to learn about what mental health is and what it is not, what other resources are out there. It can be going to your local clinic. Every tribal health organization around the state has a behavioral health department, and that's a very direct way of getting access to those services. ANTHC also has the Behavioral Health Wellness Clinic that can provide you telebehavioral health services remotely. When it comes to caring for other people, or when you notice that someone is struggling, and maybe you're concerned that they are experiencing a mental health or behavioral health condition or crisis, but you're not quite sure what to do, one of the best resources to reach out to is 988. 988 is a resource that you can call or text 24/7, 365 days a year, and someone will pick up the phone.